Hello, I'm Dr. Rohini. Today I'm going to talk about all the myths related to IVF. No, that's not true. In an infertility clinic, we would start with the basic ovulation induction, IUI, and if nothing works out, then you would be offered IVF treatment. No. In vitro fertilization is basically advanced reproductive technique. So it is done for both male as well as female. So infertility is like a couple problem. So in case like if the male has reduced sperm count, or if there is any abnormal sperm parameters, or if there is no sperm found in the semen, then we can also take it out directly from the testis, process it in the lab, or we can do other procedures. So IVF as such is not just for women, it is done for both partners. This is not true. Yes, a lot of couples do conceive in the first attempt, but then again, it depends patient to patient prognosis. Sometimes even if everything is all right, it is possible that patient will conceive with the second attempt or third attempt, that is second embryo transfer or third embryo transfer. So this I'm telling because a lot of patients come to us and they get very disappointed because they expect that immediate result, that okay, we have done IVF, that means there is going to be 100% result. No, that's not true. If you go to any infertility clinic, what we tell you is that yes, IVF offers, according to all studies done and everything, IVF offers only 50% success rate. But yes, if the patient's prognosis is good, if everything both the partners are healthy and there are minor abnormalities, then yes, the success rate can go even up to 70 to 80%. But no clinic offers 100% success rate. So this is a common fear that all the couples have and they want to try naturally again and again. So let me end this myth. No, the babies born by IVF are not abnormal. 98% of the babies born by IVF are normal. There is no genetic abnormalities in them. They are as natural as any baby born by a natural pregnancy without any medications taken. So please don't worry that, okay, I have taken IVF, so my baby will have some kind of abnormality or it will be mentally retarded. And it is going to be same as any other pregnancy. And even once you become pregnant, like any other pregnant patient, we would be following up, we would be doing scans for you that would also give us an idea if there's going to be any abnormality. So please don't worry that IVF babies are going to be abnormal, which is not true. 90% of the babies that are born by IVF or test tube baby procedures are usually single babies. So yeah, yes, it used to be there more. It is definitely more common than in when you conceive naturally. But then what was happening previously, a few decades ago, is that people were transferring more and more embryos during embryo transfers, which was resulting in twins and triplets. But now there are so many advances in embryology that we prefer to usually single embryo which is of very high quality. So you don't have to worry that every IVF pregnancy is going to end up in twin babies. This is not true. Even after embryo transfer, what we advise to the patient is that you take it easy for next 2-3 days. You don't have to be on complete bed rest, and after 3 days you can even return back to your work. Depends, your work should not comprise of doing excessive heavy exercises or lifting heavy weights. Even once that you become pregnant, we don't advise that you have to be on complete bed rest because that causes other kind of complications. It can increase your risk of getting blood clots in the leg, and it can also affect the baby's growth. So it's better that you keep walking around, have a healthy routine. But like any other pregnancy, you should not do unnecessary exertion or lift heavy weights and or vigorous exercise. So that is one thing. So you can carry on with your day-to-day activities. IVF is not an indication that you have to go for a cesarean section. It depends. At 9th month, we will reassess you. Suppose everything is fine, the baby's weight is good, the baby's heart rate is good, everything is fine with the mother, then yes, the patient can go for a vaginal delivery. But yes, patients sometimes get very anxious and they opt for cesarean section on their own. But otherwise, there is no contraindication for a vaginal delivery. It also depends on patient's choice and also doctor's decision. So let me debunk this myth also. No, there have been so many studies and so many lakhs of millions of people couples have undergone IVF so far, and there is no increased reported risk of cancers in women. So please don't be scared that taking all these hormone injections is going to increase your risk of cancer or anything in the future. No, this will also not happen. This will not cause premature menopause. This will not it will not reduce your ovarian reserve, because what we do in every cycle is that we try to stimulate and increase the size and develop all the follicles that are present in that particular cycle. This does not affect your future fertility or reserve, or it doesn't cause any menopause. You're going to be healthy and you're going to have menopause at the same age as any other healthy woman. So I think today I think I managed to clear some of the myths that has been going around, because there are so many things on the internet and people assume so many things and talk to each other and get scared before coming and approaching doctors for IVF. So I hope this video was helpful for you. But if you have any doubts, we would prefer that you come in person and meet us. Thank you.